As I've blogged previously, there's emerging evidence suggesting that GLP-1 medications may help to curb drinking and even smoking. GLP-1 medications are used for diabetes, weight management, and other weight-related health issues. So examples are semaglutide, which you may know as Ozempic or Wegovy, tirzepatide, which is Mounjaro or Zepbound, liraglutide, which is Victoza or Saxenda, and dulaglutide, which is Trulicity. Could GLP-1 medications reduce other substance use disorders like cocaine, cannabis, or opioids, which is narcotics? So, a recent study looked at people with type 2 diabetes in the US Veterans Affairs database. Compared with people who started SGLT2 inhibitors, which is another diabetes medication, people who started GLP-1s had an 18% lower risk of developing alcohol use disorders, a 14% lower risk of developing cannabis use disorders, 20% lower for cocaine, 20% lower for nicotine use, and 25% lower for opioid use disorders. They also found that in people who had pre existing substance use disorders, compared to starting an SGLT2 inhibitor, starting a GLP-1 medication was associated with a 31% lower risk of emergency room visits related to substance use, a 26% lower risk of hospitalization related to substance use, 50% lower risk of death from substance use, a 39% lower risk of drug overdose, and a 25% lower risk of suicidal ideation or attempts. And I've blogged a lot before on that topic. Links are in the post that I have added below. Make sure you check those out. That GLP-1 medications could decrease substance use fits with our knowledge that GLP-1s reduce the reward response in our brain to food. I also wonder if some of the reduced tendency to use substances could be related to people often feeling better about themselves, saying that they feel like they're building self-confidence, having less pain, and improved quality of life with improvement in weight and improvement in health afforded by GLP-1 medications. As this study is a retrospective database analysis, we have to take the results with a big grain of salt. Also, being a Veterans Affairs database, the population studied was mostly older white men. 93% were over 50 years old and 94% were men. So we don't know if we can extrapolate these data to younger people or to women. So the bottom line here is that there's a growing body of evidence that GLP-1 medications may have a side bonus of reducing tendency to use substances. Dedicated clinical trials are needed to explore these potential benefits further.